Hello, my name is Daisy Flores, and I decided to do my presentation on breast cancer. And the reason that I chose breast cancer was because my great grandma, my grandma, and my auntie had it. So I just wanted to learn more about it and I wanted to share it with all of you. First off, I wanted to start off on defining what is breast cancer. So, it is a disease that is characterized by abnormal cells that grow and invade healthy cells in the body, and it starts in the cells of the breast as a group of cancer cells that can then invade surrounding tissues or metastasize to other areas of the body, which causes a tumor in the breast. And breast cancer is not contagious, but it is genetic. Here are some facts about breast cancer. So, 1 in 8 women in the United States will develop breast cancer in her lifetime. In 2019, it was estimated that 268,600 cases of invasive breast cancer was diagnosed in the women in the United States, as well as 62,930 cases of non-invasive breast cancer. And invasive breast cancer just means that the cancer has invaded or spread to the surrounding breast tissues, while non-invasive means that the cancer does not grow into or invade normal tissues within or beyond the breast. Another fact is that although rare, men can get breast cancer as well, and risk for men is about 1 in 1,000. And 62% of breast cancer is diagnosed at a localized stage. This slide talks about the different types of breast cancer a woman can get. So on the left, which is in pink, is the most common types of breast cancer a woman can get. First, we have ductal carcinoma in situ, which is characterized by cancerous cells that are confined to the lining of the milk ducts and have not spread through the duct walls into surrounding breast tissue. Second is lobular carcinoma, which begins in the lobes, which is the glands that make breast milk, that are connected to the ducts which carry breast milk to the nipple. Third, we have invasive ductal carcinoma, which begins in the milk ducts and spreads to the fatty tissue of the breast outside the duct. And lastly, we have invasive lobular carcinoma, which starts in the lobules, invades nearby tissue, and can metastasize, meaning spread, to distant parts of the body. And then some other types of breast cancer is metastatic breast cancer, inflammatory breast cancer, triple negative breast cancer, and Paget's disease. And this picture just shows where these types of breast cancer can be found. And this slide talks about the different diagnoses a woman can get. So first is breast exam, which is the doctor will check breast for lumps and other symptoms, either sitting or standing with their arms in different positions. And we have imaging tests, and the different types is a mammogram, which is a type of x-ray that doctors use that produces images that can help a doctor detect lumps. We have ultrasound, which uses waves to help doctors differentiate between a solid mass and a fluid-filled cyst. And third, we have an MRI, which combines different images of the breast to help a doctor identify cancer. And lastly, we have a biopsy, which is when the doctor extracts a sample of tissue and sends it to the lab. This slide talks about the causes and risk factors of breast cancer. So first we have aging. So breast cancer mostly occurs in older women, and as I said earlier, men could get it too, but is less likely. Second, we have a family history of breast cancer. So if your mother, your grandma, or anyone in the past had breast cancer, you more likely have a risk of getting it. Inherited genes, so there's certain gene mutations that increase the risk of breast cancer and can be passed down from parents to children. Radiation exposures, most likely if you had radiation exposure to the chest. We have obesity, which after menopause, women who are overweight have a higher risk, possibly because of estrogen levels. And then we have beginning period at a young age, never been pregnant, or consuming too much alcohol or alcohol at all. So this slide talks about the signs and symptoms of breast cancer. So first we have lump, hard knot, or thickening inside the breast or underarm area. Then we have swelling, warmth, redness, or darkening of the breast. We have change in size or shape of the breast, dimpling or puckering of the skin, itchy, scaly, sore, or rash on the nipple, pulling in of your nipple or other parts of the breast, nipple discharge that starts suddenly, or new pain in one spot that does not go away. And on the right are some pictures showing you what it looks like when you do have the signs and symptoms. This is the different stages of breast cancer. So we have stage 0, which is ductal carcinoma in situ, and the cells are limited to within the ducts and have not invaded surrounding tissue. Next is stage 1, and the tumor measures up to 2 centimeters across and has not affected any lymph nodes. Stage 2 is the tumor is 2 centimeters across and it has started to spread to nearby nodes, or is 2 to 5 centimeters across and has not spread to the lymph nodes. Then we have stage 3, and the tumor is up to 5 centimeters across and has spread to several lymph nodes, or the tumor is larger than 5 centimeters and has spread to a few lymph nodes. And lastly, stage 4, the cancer has spread to distant organs and most often the bones, liver, brain, or lungs. And on the left just shows the picture of the different stages and how it affects the breast and how worse it gets after each stage. This slide shows the different kinds of treatment an individual can get, and treatment depends on several factors, which is the type and stage of the cancer, the overall age, overall health, and the preferences of the individual. So first we have local therapy, which is the cancer is taking out of the body and is capable to stop the expanding of the cancer cells and remove out of the body. So first we have surgery, which is lumpectomy, which involves removing the tumor and a small amount of healthy tissue around it. And then we have mastectomy, which involves removing the lobulus, ducts, fatty tissue, nipple, areola, and some skin. And then we have radiation therapy, which involves using a machine that produces a beam of radiation. Next, we have systematic therapy, which is just based on drugs. And then the first one is chemotherapy, and that is a doctor may prescribe cytotoxic chemotherapy drugs to kill the cancer cells if there is a high risk of reoccurrence or spread. Next is hormone therapy, which is used to prevent hormone-sensitive breast cancers. And lastly, we have targeted drug therapy, and it's drugs that can destroy specific types of breast cancer. And this slide shows prevention. So first is becoming familiar with breasts through self-exams. So just by feeling your breasts at night, in the morning, whenever, just to become familiar with how your breast should feel and make sure there's no lumps. And then next we have drink little to no alcohol. So limit the amount of alcohol intake one should have. Exercise most days of the week. So aim for about 30 minutes of exercise on most days. And maintain a healthy weight and healthy diet. Just eat healthy foods and try to stay away from fatty foods. And on the right is just a picture showing the different kinds of prevention. So this slide shows regular screening, which is very important. The American College of Physicians recommend that women aged 40 through 49 years within an average risk of breast cancer should discuss the benefits and risk of regular screenings with a doctor. Women from 50 to 74 should undertake screenings every 2 years. Beyond 75 years of age, doctors recommend screenings 10 or more years. And then the American College of Radiologists recommends screenings every year from women starting the age of 40. This slide shows survival rates and deaths, and as you can see, there's two graphs. The first graph has a 5-year relative survival rate, which is from 2005 to 2009. And as you can see, the survival rates in most of the countries are high, starting from the United States, which has 89%, to the United Kingdom, which has 81%. And after that, you can see it starts going down slowly until it hits South Africa, which is 53%. And on the right, the second graph is the US breast cancer deaths per 100,000 women by race and ethnicity from 2009 to 2013. And as you can see, it shows how Black have the most deaths at 29.6%, and how Asian Pacific Islander have least deaths, which is at 11.2%. This has the most common areas of breast cancer. So as you can see, breast cancer is the most frequent diagnosed cancer in 154 countries, which is a lot. So I'm just going to point out the countries that I already know, which is the United States, Canada, Mexico, Brazil, Argentina, Russia, China, Australia, India, and as you can see, many more other countries. And the second is a cervix uteri, which is the second most frequent diagnosed cancer, which is mostly found in Africa and countries like Madagascar, Angola, Zambia, Mali, and other countries. October Breast Cancer Awareness Month. As many of you already know, it is a worldwide campaign involving thousands of organizations to highlight the importance of breast cancer awareness, education, and research. It aims to get as many people possible involved in raising awareness and funds to help support life-saving research. During this month, charities and foundations put together events like marathons and half marathons.